Tell people is, the nice thing about this is you can do this step, to have it ready to go. If your protocol is for labor delivery, you want to have this ready because you want to get CPAP on the baby right away. Go ahead and do this. It goes right into standby and it'll wait for you. So you don't have to think you're rushing around right at the baby's bedside. You can set that unit up. You knew you had that delivery going on. It'll stay in this stage for days, so let it go ahead and get somebody to configure.
That's really actually a good feature. Because, they didn't quite deliver, it's 8 hours, until they do now, and then we're good set up.
Yep, I mean, that mom down there is at 35 weeks.
Right.
It's not a secret. You knew her when she was, expected, you knew her due date, so they know they have a potential high-risk delivery.
Right.
You can have this set up because as soon as you knew that went on, go ahead and get this thing ready. Mm-hmm. The only thing you'll have to do is pick out the right interface, and we're going to go over that in a few minutes. So you can see it says it's ready to deliver gas. So we're ready to go, but what we have to do now is connect up to patient circuit and size the baby. Stop and ask if there's any questions. So I did check. When it's coming out of this, you can't change the settings right here. It's that cold start. You can't change them like when it's in standby.
You mean it won't allow you, or you shouldn't?
It won't allow you.
Okay.
Without responding from a cold start.
Okay.
So that's why my recommendation, as you talk through more of the implementation protocol part after this, like you get them in service, here's some things you want to consider. Like, do you want to establish an initial setting that the unit always gets put back to? Because it's not like a hard knob, right? Kind of thing. So that's just more of the feedback part at the end of, you kind of want to think about this when you're doing your protocol. Is that, when we're done with the baby, we want to clean it up, whoever checks it out, RT checks it out, but maybe they should put it back to, 5 centimeters and 25% FiO2. If that's always your starting point, you'd like to know that's your initialization because you don't know what it is right now. Okay. So we're going to let that sit there because it's ready to go. We're going to come over and talk about how to, does your phone catch me over this way?
Yeah.
So then I would bring out the baby doll, and I would have the trial pack and say, we've got you a trial pack here. There's a little bit of everything in here. So as you're going through your evaluation, there's some of every size mask, some of every size cannula, all the bonnets, and a bunch of delivery circuit adapters. But we'll go through the parts. So normally this isn't all set up. You're doing it from scratch, obviously. So I always grab a delivery circuit adapter and say, this is the first thing you get. And it's in black on here. It says delivery circuit. It looks like this, but we did black because we thought this gray was hard to read.
Yeah, makes sense.
So you always know you're going to need a delivery circuit adapter. So we put everything in here to get you started so that you don't have to worry about opening up an interface that might not be right or a bonnet that might not be right. Everything you'll need is in here. So open it up, take it out. So you can either have this stuff like set out already and just hold up a delivery circuit. I usually try not to use their stuff up by opening it. So I usually take like one more of my own, but that's just your preference, however you want to conduct it. And then sometimes I'll have it sitting out ahead of time. I'll say, this is what the package looks like. Here's your package contents. You get a sizing guide that we're going to use to measure up the baby's face for either cannula or mask. It's all in one. We have a disposable tape measure to help select the bonnet. Very simple to use. You can see it tells you right on there. If the head circumference measures between certain values, that tells you what size bonnet. We have the part we call our delivery circuit adapter. This is what's going to connect the humidifier to our mask or cannula. This line will go back to the NeoPap because we're measuring pressure at the nose. This is our feedback line. What kind of humidifier are you using? Oh, you're using F&P? You don't have to worry about these. These are, if you're using a Hudson humidifier, you can just discard these. These are extra parts. If they were using a Hudson humidifier, I'd say, okay, those parts you need to use. So you can either put it inside here first, which is a bit of a tight fit, or put it on the outside of the connector, but the Hudson connector is a bit smaller, so you need to use the little gasket. Haven't come across anybody doing that yet.
Okay.
So let's measure the baby real quickly to show you how easy this is to use. You just take the tape measure, simply set it down, place the baby on the tape, and measure right about the crown of the forehead. And it would actually help if I turned it the right way.
Wow, that's a big head.
Yeah. No, it's actually turned out to be a really small head because it's a 13 because I was going the other direction. So you measure around the circumference of the baby's head. This baby measures about 27. 27 will be a small. So you pick out a bonnet that's a small, and I might grab one of them and point to where the size is on there. So you'll need a small bonnet, and we can decide what we're using. Most people would start with a cannula, I would think. But very simple sizing gauge. So these two holes, the black and the clear, are exactly the same. It's just your preference. Do you like looking at the black dot to see if you can see the baby's nose around, or you want to look through the clear circle? But you just kind of loosely hold that up by the baby's nose, pick the size that best fits. If you're unsure, you feel like you're between sizes, always pick the smaller one. We don't want to put any undue pressure on the baby's nose. We compensate for leaks. That means we can have a little bit looser fitting interface.
Gotcha.
Same thing with the mask. If you're going to use a mask, you can just hold it there and you just want to make sure that the baby's nares fit in the horizontal part of the mask. Just pick the smallest mask that fits as well. So I looked at this baby and I think they should use an extra small cannula. So I'd go get my extra small. I would say this is our cannula. You can see the sizes on there, so once it's out of the package, you can always come back and check just to make sure so you know what it is if you need to keep track of that on your charting or anything else like that. You can see the design has two tubes on one side, one tube on the other. You need to remember the two tubes always go on the baby's left. We're going to talk about the function of the tubes later, but the two tubes are on the baby's left-hand side. That works for mask or cannula. So we got our bonnet. Again, these would not have been on there. So our bonnet has some unique features. One, it's lined with this very soft, comfortable lining. Usually pass it around. People love the feel of it. Sucks them right in.
Okay.
They're like, wow, that's great. So it really does. It gets their attention because nurses are used to that. I want something comfortable on my babies, right? Because that's, they call them my babies.
My baby.
So this will get their attention. You say, now we designed the bonnet to be very easy to apply. One person can do this. After I get it on, I'll show you it also kind of won't interfere with some of the other care that you need to provide the baby. So to put the bonnet on the baby, now that we've got the right size, we simply set the baby down right in the center of the bonnet. We want that to be low on the neck, not all the way down at the shoulders, but we want to get under their occipital lobe, but low on the neck.
Okay.
And then simply wrap it across the baby's forehead, lightly secure. Make sure that it's even on the baby's forehead. Very simple. Anybody have any questions? We're gonna do something like that. So, as I said, the bonnet's designed to help you with some of your care. So we left the top open. We know you don't like to, we know parents don't like to see it, but we know you do scalp IVs, right? This is a level 3 discussion. Level 2 is probably not doing scalp IVs.
Right.
We say you can put a scalp IV in here. You can see I can take this right around it. I'm not going to interfere with that IV at all. You can put it in with the bonnet on. So, very easy. Also, when we put the interface on, you'll see that you can keep the interface in place. If you needed to come in here and do a cranial ultrasound, you can just kind of have somebody hold this open. Go ahead, move your probe around as needed, and then secure it right back up, and you didn't have to interrupt therapy for the baby. So, like that. And then move on and say, okay, so in the package, we get these hockey sticks, we affectionately call them. These are the tubing guides that are going to help you customize the placement of the interface to the baby's face so that you can get it just right. We're not forcing you into one spot that may or may not work for that baby. So what our goal is, we want our cannula to go laterally under the nose. We don't want it coming up across the eyes, coming up across the cheeks, but we want it going straight across the nose. So one side has the hook material, the other has that same foam lining. So the hook goes towards the bonnet, and I just want to eyeball it and get that so that I'm going to come straight across. Do the same thing on the other side. like so, with them routing towards the top of the head. So now I take the cannula, just place it gently in the baby's nares. Again, we want a reasonable seal, but we don't want a tight fit. We shouldn't see flaring. We shouldn't see skin whitening from blanching. We want to get that positioned about the way we like it. Bring the first tube over. And again, these tend to lay flat better when they're first out of the thing. All I'm going to do is I'm going to loop that one over to make sure it's where I want. Make sure it's out centered. Same thing over here. Get that positioned where I need it. Quick check, looks very good on the baby. So then I'll just come back and secure the remaining straps to get the tubing routed up and away from the baby's head. So it's all out of the way. This little tubing management guide is just that. It helps keep things a little bit neater back here. There's really no requirement where you place it. Just make it so that it feels neat and comfortable for you. We usually stop at that point, see if anybody has any questions about things. I almost always do the demo with a cannula. Could do it with a mask. We just don't provide them as many of them, so
Okay.
there's no harm in doing it with the mask. So now to connect the baby to the NeoPap system, we have our delivery circuit adapter. What do we do that one? Must have ripped the valve out of that one.
All right.
Couldn't have done that again if I tried. So we have our delivery circuit adapter, as we called it. One thing to note, there's a black mark. This makes it very easy. We're just going to align black to black in a minute. So that tells you which direction to put it on. We have a pressure relief valve here because this is where the humidifier, the gas from the NeoPap, is going to be delivered. This is a safety mechanism. Assuming that that thing lost total control of everything, this will open up and keep the pressure from getting too high to the baby. It'll keep it under about 38 centimeters of water. I need to confirm that number to get you the exact right number, but I'm pretty sure it's 38, which is safe. That's your pop-off pressure on manual resuscitators and things like that. If they kind of, like you say, it's a safety protection for that thing totally losing control, if that were to happen. So we're going to put this together. I really strongly recommend, you probably have gloves on your hands, so I'm recommending that you hold it on the sides. Because if you hold it here and you push these together, you'll be able to put it together, but you may fold that valve, and then you're going to get a leak in the circuit that may not be so easy to detect visually. But very simply, we line up our black arrows, that way we know it's going together the right direction. Seat the part so that it's just down, it doesn't take much. Then we take this cap, which we'll talk about the reason for this cap in a little bit, and plug it in there. Take our line, get rid of all this, from our humidifier. It plugs in like such, and the baby's going to get pulled off the table. Should have gone to DC power. So we connect our pressure line to the little port, connect our main line up. So now everything's connected and it says we're ready to deliver gas to the baby. So the way NeoPap works is the humidifier, we do what's called flow by. We call flow by. So we have the gas coming down one side of the tubing on the left, flows across the in front of the baby's face. The baby just takes what they need. There's pressure is maintained right here, but there's extra flow that's constantly flowing, exits over here. There's 3 openings so that you can't block this. Any one of them is more than adequate to vent all the air that would come out. Small tubing that goes right to the tip of the nose. That one goes back here to NeoPap. That's connected to the internal pressure monitoring. That's what helps us control pressure at the nose when there's a leak. We can see that the pressure's dropped. We can add flow or decrease flow as needed by monitoring the pressure at the nose. So we're controlling it right there at the tip of the nose, whether it's a mask or a cannula. This little port, probably won't need to use it a lot, but sometimes you get